Dear friend, welcome to this short presentation on the Bangalore Medical College Development Trust Infosys Bone Marrow Registry. The Bangalore Medical College Development Trust is an offshoot of the Bangalore Medical College Alumni Association. The BMC Alumni Association has been working hard since the year 2000 for the development of the Bangalore Medical College and its infrastructure, and has also been focusing on public awareness and health education programs. Certain benign diseases like thalassemia, particularly seen in children, and aplastic anemia and sickle cell anemia, and cancerous diseases like leukemias and lymphomas and other diseases need bone marrow transplantation for the survival of the patient. The treatment results in a situation where the patient is unable to form blood cells that are essential for his existence. The stem cells, which are responsible for forming the blood cells, have to be then transplanted into these patients from normal, healthy donors. There is a great need for bone marrow transplantation in India. Accurate data are not available, but on an average, a specialist in the field sees at least 10 to 12 cases each month. Extrapolated to the national level, the requirement seems to be around 60 to 75,000 transplantations a year. In fact, 90% of them do not get it. And the main reason for not getting a transplant is the lack of availability of a donor. And so by being a donor, you are literally saving thousands of lives in the country. The lack of donors seems to be a particularly Indian problem. Good registries exist in the USA and Europe, and in the West there are some 18 million donors on their registries. The latest entrant to the field of good bone marrow registries is China, which is supposed to have built a very good registry in a short period of 5 years. As we mentioned, there are very few names of South Asian stock, that is the Indians and their neighbors, on bone marrow registries. And because of this, if a patient is looking for a donor to get a transplant done on himself or herself, he or she finds it extremely difficult to find a donor, and on top of it, it is a very expensive proposition. We in the BMC Development Trust felt that we should fill this hiatus. We have successfully completed major projects like the establishment of the digital library and the clinical skills center in Bangalore Medical College. In addition, we have opened out to the public in the past with health awareness campaigns and several seminars covering important aspects of healthcare in the country. But we thought we should do something much bigger than that, and hence we have embarked on this onerous task of establishing the bone marrow donor registry. This is a project that is going to last several years, but for the first year we have a modest goal of having 10,000 names on the registry, All of them will be HLA typed. We'll learn a little bit more about HLA in a minute, and all the matching will be offered free of cost to patients all over the world. The HLA typing, or the human leukocyte antigen typing, is essential for conducting a bone marrow transplant. It is an expensive proposition. We envisage an expenditure of about 4 crores for this project this year, and we are glad to announce that the Infosys Foundation has promised 2.5 crores for this year. Bone marrow transplantation needs HLA typing in addition to the usual ABO typing that is given for blood transfusion. The HLA is a form of protein marker on the blood cells which are responsible for recognizing self from the non-self in the blood. For a successful marrow transplantation, there must be a good match of HLA markers between the recipient and the donor. When a good match is available for benign conditions, the cure rate is 100%. But for many cancers, the 5-year survival is usually in the region of 60 to 70%, which is a good percentage of success as treatment for cancers go. To establish a good marrow donor registry, we need to have motivated donors who are between 18 and 50 years of age. They need to be of reasonable good health and must not have any communicable diseases or cancers. What is important is that the donor thinks things through before signing up. There can be a considerable gap of months or years between the time one signs up to be on the registry to the time one really gets called to give a stem cell donation. Once a donor gets himself registered, he has to be committed for this donation forever. It is very important to be so, because if one changes one's mind when a request comes for a marrow donation, it can be devastating for the patient. Also, it is important that the donor keeps the registry informed of a change, if any, in contact details. The process of marrow donation is quite simple. Initially, donors who agree to be on the registry are typed for their HLA pattern. The extracted DNA from which the typing is done is stored so that if newer techniques of HLA typing come on the scene later, the donors need not be disturbed for another sample of blood. They are also screened for infectious diseases. Once the HLA typing is done, the names will then be registered on the bone marrow registry. Confidentiality is strictly maintained, and much later, when a patient's HLA pattern matches with that of the donor will then be contacted by the hospital which is undertaking the transplantation through the bone marrow registry. To be a part of this process, You will have to initially, at the time of giving the consent for donation, give 10 milliliters of blood for HLA typing. Later, if and when a match occurs, you will be requested to donate stem cells. Most of the stem cell donation occurs through a process called pheresis, where you are hooked onto a machine, as is shown in this picture, for the separation of stem cells. To have stem cells in the peripheral blood, you will be given 1 injection a day for 5 days, and on the 6th day you will have to go to a hospital and spend 4 to 5 hours with a needle stuck into one of your blood vessels on the arm, through which you are hooked to the machine where stem cells are separated, and the blood after the separation of stem cells is put back into your body. Rarely, a marrow donation itself may occur, and this involves taking the stem cells directly from the marrow. Whatever is donated is regenerated within about 3 weeks. There is no cost involved to the donor, and side effects are minimal with no major consequences. These include mild pain, perhaps a little bleeding under the skin called a hematoma at the site of the puncture, and rarely the area of puncture may show some signs of infection. Why should you be a donor? I think the overwhelming drive is the realization that you are literally saving lives by enrolling yourself on the Marrow donor registry. The feel-good factor is something that one cannot describe in words. As a token of gratitude for the good public cause that you have participated in, you will get a certificate, a donor card, and a lapel pin. What is very important is that in addition to being a marrow donor, you need to show leadership in motivating others, and you will be the best motivator because you have the moral authority to request others to donate marrow stem cells, having been a donor yourself. To summarize, bone marrow donation is a 2-step process. In the first step, you give consent to be a donor and give 10 ml of blood for HLA typing. Much later, when your HLA type matches with that of a patient who needs a marrow transplant, you will be contacted by the registry and the hospital, at which time you will give a peripheral blood stem cell donation. Signing the consent form is a requirement to get on to the donor registry. You will see when you receive one that it has 3 major components. The first is a privacy statement where you are assured that your personal details will remain confidential. The second part is a donor declaration where you basically declare that all these issues which have been explained to you have been understood and that you are agreeable to be on the donor registry. And the third part is an application form which basically gives your details and contact information. So here we go. We request you to come on board, become a donor, stay committed so that you will go ahead with the donation when the call comes, And very importantly, we would like you to motivate others to be donors. We would like you to volunteer time to spread the message, because unless thousands of people get into this volunteering and create a wave about bone marrow donation, we are unlikely to succeed in this project. And finally, HLA typing and maintenance of a registry is an expensive affair, and we request you to try and raise as much money for this noble cause as possible. If you have any questions or suggestions, please feel free to write to bmcbmr@gmail.com. Thank you very much.